Hello and welcome. I am Steve CLEMONS, Editor-at-Large of The Hill. We're delighted to have you joining us for Safeguarding Seniors, our live virtual event examining how we should be caring for older Americans in the time of the coronavirus. From timely quality care to the role of innovation, we're going to be asking lawmakers and experts how the current infrastructure can be beefed up to meet our needs. We'll ask what is being done to eliminate disparities that are exacerbating the situation for African American and Hispanic communities and others in need. I'd like to thank our sponsor, the Better Medicare Alliance, for supporting this event and making this conversation possible. Before we get underway, a few housekeeping notes. You can tweet us at #TheHillVirtuallyLive. I know that's a lot of characters, but that's what we've got. We are broadcasting live and we'll be calling on you, the audience, to reach out with questions. Some of you will get to ask your questions live and on video, so I hope you're prepared for a camera. If you want to ask a question, enter it in the Q&A menu at the bottom of your screen. And if you experience any trouble with the video, I'm told that refreshing the page should mostly fix the problem, and that probably goes for me too. Now let's dive in. Our first guest this afternoon is Congresswoman Doris Matsui of California. Congresswoman Matsui is a member of the Energy and Commerce Committee and is the co-chair of the House Democratic Caucus Task Force on Aging and Families. Congresswoman, thank you so much. And first, let me just say, I know you got married on Easter. Congratulations. That's going to be a memorable time. So that was some very nice news to see. So how's it going so far?
It's very well. Thank you very much, Steve, for mentioning that. And yes, even during these times of clouds, there's some light there. So we're really happy.
Well, I know you were the co-chair of the Task Force on Aging and Families, and you have sought out to look at kind of core pillars that we should be considering when we think about seniors and our obligation to them. I think you've even called it an Older Americans Bill of Rights. And I'd love to get a sense of what you feel are the key pillars that we should be worried about as we think about public policy and our communities today.
Well, I think in particular, if we look at some of the challenges we have today, the Task Force on Families and Aging have really looked forth on things like healthcare, financial security, protecting caregivers, long-term facilities and oversight of them, and food security. And in particular, our focus with this COVID-19 crisis has been from the range of issues, from safe grocery shopping to how do you get your regular medical care, to oversight of senior facilities, nursing homes. And as we move forward, we really felt that these are principles that are important anyway during any time in a person's life, but we really want to emphasize that we're there for the seniors and want to ensure that they get the help they need and deserve during this time. And a lot of the principles really involve healthcare. That's really very important to seniors, as you know. Medicare, the importance of that, especially during these times, even opening up the enrollment for Medicare for those people who probably did not get on at the right time. Opening up a special enrollment for the ACA. We think that is really very important too. And we really want to make sure that seniors do not have any negative outcomes because of this crisis. They are particularly vulnerable, as we know. And because of that, we want to ensure that we really focus on the principles that we feel are really very important. You know, seniors are afraid to leave their homes if they're in homes. If they're in senior care homes, obviously they can't. And so we're trying to figure out how they get their medical checkups, care that they need. One of the things that we found out that we have been expanding telehealth during this time. And this is an opportunity that we've always felt was there, but this has really pushed it forward. And what we've done here in the CARES bill and everything else was open it up.
Right.
So that seniors can actually get their care from their homes or from any other site using any kind of device, phone, smartphone, they can use Skype or whatever. And this is changing, I think, not only healthcare for seniors during this pandemic, but for everybody. And I believe that as we move forward, this is going to be one of the things that we can look to as changing healthcare.
Well, there's been a lot of talk about telehealth and Medicare, at least right now, paying those bills for telehealth care and the doctors. I don't really know all of the details of it, but I was speaking to Congresswoman Donna Shalala, and she said, Steve, that's really important, but there's some blind spots out there in this too, that some people are finding it a real struggle to get bills paid, and also the computer literacy is just an expectation. And I'm interested, you know, you're in the Bay Area, and maybe there's a kind of a different crowd there that's more computer literate, but do we have blind spots when we look at how we're innovating to reach seniors?
Well, of course we are, but you can use any kind of device. They can use a phone, so they can check with the providers in that way. Obviously, not everybody is computer literate, and obviously we have to force that on them too, but this is a situation where, because of the fact you can use any kind of device, it's open to everyone. And the fact that we use Medicare to open it up so we can get reimbursements. And we're expanding it even further because as we look forward, you know, we have it for now for the federal qualified health centers. Behavioral health is so important now, particularly during these times. And we find, and I'm talking to my community health providers, these clinics now are now, as far as their appointments for behavioral health, it's all full. And they're using telehealth. And it's been absolutely incredible. And you look at the aging workforce too, the physicians, the psychologists, everybody, they may not feel as comfortable, in fact, seeing people, but they would if you can telecommute and really act in that way. And so this has been a time when we have used technology. And I think it's important to recognize that we have to continue this too. Been important not only for the senior community, but for everybody too. And that's one of the things that have come out of this, obviously, during these troubled times. But, you know, seniors also need to understand that they have to also think about themselves in a sense of not only themselves, but their caregivers too. We have to have safety caregivers too. So these are the important things as we move forward, that we consider seniors as the population as part of a family. And so, particularly during these pandemics, it's going to be so important to look upon the people who are the caregivers to ensure that they have their own financial security and make sure that they have paid leave so they can take care of the people in their household. And we go through this whole range and we find one thing will lead to another. And even as we're looking at this, thinking also about how we use like food security, you know, making sure that seniors can get their food, maybe with, you know, extended SNAP, obviously, but using EBT, the pilot there. So in a sense, because of the fact we are having to be sheltered, people now are looking at things differently too, because they've had to, absolutely had to.
Right. I'm interested, you know, right now, we finally moved to the costs of testing. So a substantial portion of the cost portion of people's health right now is being more widely covered because of the time we're in. You and I have talked in the past that we've had struggles over, you know, drug prices and struggles over every little bit of the healthcare scene. But right now we've got a wide aperture that many of those costs are being covered. Are you worried about this being rolled back after the coronavirus era, if you will, is sort of brought to a narrow thing, that we're going to lose the funding, the support, this wider aperture for supporting people's health needs?
I don't believe we can narrow this aperture at all. If you look at what's happening in this pandemic, we understand the importance of, for instance, testing and contact tracing and isolation and treatment. That's never going to end when you think about the world we are in today. Public health has to be reconfigured so we are prepared for these things happening. And I also believe that healthcare, I mean, I've always believed in universal healthcare. How we do it might be challenging, but on the other hand, if we look at what's happening today, healthcare is having to change. And if you look at, as I mentioned, telehealth, that's been something we've talked about for a very long time. We are pushing it out now in a way that we never have. And I really believe that as we push this out even further, we'll find out we even have cost savings too. And undeniably, our workforce is being challenged today too. And by using technology, I believe that we can expand the workforce.
Well, thank you. We have a question from our audience. This is Geetha Bansal. I think Geetha is joining us. It may take a second to bring her on. Geetha is a program officer at the National Institutes of Health. We'll see. Geetha, are you there? I see a very cool little avatar. Has Geetha joined us?
Can you hear me?
Yes.
Yes, I can hear you great. And I love the, I guess it's a monkey.
I didn't even know it was going to come on.
Well, it's wonderful.
Well, Geetha, the floor is yours. You have a question for Congresswoman Matsui.
Yeah. Thank you for allowing me to ask this question. So my question is as follows. So understanding and acknowledging that it is an unfolding story, nevertheless, it is well known that being old is a risk factor for several health associated conditions. And being old, along with these underlying health-associated conditions, is definitely a risk factor for COVID-19, which is what we're all facing now. So my question relates to, compounded by the knowledge that asymptomatic transmission is occurring every day, what are the plans for getting older people into the workforce, those that are greater than 50, 60, in such a way that it is safe for them?
Right.
Well, as there is no stigma and discrimination associated with being old.
Terrific question. Thank you, Geetha. Thanks for joining us.
Thank you, Geetha. Yes, I really believe that this is something that we should really look at, because honestly, testing is going to be really very important in order to ensure that people can go out and finally be able to work the way they want to work. I think testing is always going to be a part of this through this period of time, whatever it is. And if we have a workforce that is being challenged, I really believe that that's, in a sense, important to make sure that those individuals have the testing that they really need. And that's why in these areas where you have seniors congregating, where you have more senior population, testing is going to be vital there. And I really believe that that's going to be part of the way we live for a while. And also, too, as I mentioned, telehealth. A lot of the providers perhaps now will be using telehealth much more than they have before. And particularly as we bring in people who want to work, who might have been retired, decided to take a break, they can also participate in telehealth too. So we might be expanding that population of workforce.
Well, Congresswoman, thank you so much. It's great to spend some time with you today. I hope we do this with you every day.
That would be great. Thank you.
But thank you very much for joining us.
Thanks a lot. Appreciate it.
Now, joining us next is Congresswoman Matsui's colleague, a Republican member of the Energy and Commerce Committee, Congressman Bill Johnson of Ohio. The congressman has for a number of years been an advocate of expanding telehealth services. Today, that need is greater than ever. I should also add, because I read up some of what he's been doing, and it's so important about rural health, which is a big issue for me as well. I'd love to talk to Bill Johnson about that. Welcome, Congressman. Thanks so much for joining us. Give us a quick snapshot and dashboard of how your community is doing, both seniors, but I think sometimes we're not discussing the rural gap with a lot of what's going on in cities. So give us a quick snapshot of that.
Well, seniors in my district, Steve, first of all, thanks for having me on today. Seniors in my district struggle just like every other group of seniors do in terms of health care. It's expensive. The choices are few and getting fewer. I remember when I was first elected back in 2010, the first conversation that I had with my then 80-some-year-old mother, she said, "Hey, this is not a congratulations call. This is, you better make sure that nobody messes with my Medicare, because if they do, I'm coming to live with you." And it was a very stark reminder of just how important Medicare is to seniors. And so we've got to strengthen and preserve that program. One way we can do it, Steve, is through the use of telehealth. Telehealth is a great, great tool. And if there is a silver lining in this dark cloud of the coronavirus, it's that the nation's eyes are now focused on just how urgent it is that we bridge the urban-rural digital divide, because there are hundreds of thousands of Americans all over this country, many of them that I represent, that do not have access to broadband internet, and so they can't do telehealth. And it's a less costly. We had some provisions in the phase 1 supplemental that broke down some of those barriers so that Medicare providers could offer telehealth services and get paid for their services. We need more of that kind of thing if we're going to continue to bring healthcare into the 21st century.
Representative Johnson, I sometimes ask questions I always know the answer to, and this one I really don't. What is the problem? What has been the problem with CMS paying for telehealth in the past? I know we are now, and there's some concern that this could be rolled back, but I guess I'm trying to understand why we weren't doing it before. Do you have any thoughts on that?
Well, that's a good question, and I don't have a short answer for you, Steve. I will just say this: anytime there is new technology, you've got early adopters and you've got people that are slow to come on board. Our system of government was never one that was designed to move fast. It was designed to move slow. If you look in the century after the Civil War, the industry that progressed the most and the most rapid was the information technology industry. And it's because the federal government could not figure out how to regulate information technology and IT. So some of this comes from just a lack of understanding of just how important and how valuable telehealth could be. I think it's just simply being uninformed. The truth of the matter is healthcare providers have wanted this for a long time. Healthcare patients have wanted this for a long time. And it's time we do this. I'm really hoping that joining with my colleague like Doris Matsui, that we can make some of these provisions permanent and get the federal government out of the way so that innovation can be the high bar that we're achieving, and that providers can have access and that patients can get the benefits.
Thank you. I guess I'm going to out my friend Nancy Lamond of AARP. We've been talking for a long time, and she had this great line once that, Steve, you work with retired people. We said the future of retirement is work. And to go back to that interesting question that was just posed by Geetha Bansal about elders, the 50+ community as such an important part of the workforce, as a wise part, as a strong part, as with deep knowledge, et cetera, stabilizing part of the workforce. Is, as you've looked at that and people are talking about the future of retirement, has it changed because of the coronavirus, or do you think we're on a pathway to make sure that we have kind of intergenerational inclusion in the workplace?
Well, I think that's one where we don't know what we don't know. I think it's going to be an interesting social study to determine how the virus affects retirement. You know as well as I do, we've got 10,000 baby boomers retiring every day. We've already got a mass exodus of our intellectual property and our workforce in America, the baby boomers that are going on to the Medicare and Social Security rolls. So I do believe that that this will give everybody pause to stop and think. I'm hoping that we can keep that generation around for a while longer. We already know that people are living longer than they were anticipated to live when Medicare came into being. So we've got people staying on Medicare a lot longer. Just because you've turned 65 doesn't mean that you don't have anything else to offer. And well, I sure hope that we can stem this tide of retirements.
I also want to ask about some of the things I've sort of tried to school up a little bit on Medicare Advantage and some of the parts of this blanket of health protection that we have in place now that we didn't have in place before. Another element has been a blanket waiver for out-of-network coverage with no cost sharing or copay. So there's quite a bit of support that's been brought on. And I know that nothing is permanent, but I'm interested in the kind of innovations in the health play sector. You're in the Republican caucus. The Republican caucus has not been, I'll just be honest, on the robust side of providing, looking at all those things. How much of the current blanket of coverage do you think you and your colleagues will be able to sustain politically?
Well, I've got to disagree with you a little bit, Steve, that Republicans
That's okay.
that we haven't been on the robust side. we've been struggling with this for the better part of the last 10 years. How do we strengthen and preserve Medicare to make sure that it's there for future generations? Medicare Advantage is one of those programs that have wide popularity. It's one that works. And I think it's a model that we can look, if we wanted to streamline Medicare, why not look at Medicare Advantage as one of the ways of doing that? You know, giving choices to the beneficiary to make their own health care decisions. I think that that's a big one. I think the after action that we're going to see happen, and I think it's going to be a necessary process, is to look and see what of these waivers and things like that, these temporary policies that we put in place, how many of those produce the real kind of benefits that we need to see permanent? I think you're going to have a lot of discussion around that. I think the American people are going to begin to say, look, we know that you can trim regulations when you want to. We need you to want to a lot more frequently than just waiting until we get into a crisis.
I want to go to a question in just a moment. We have one lined up, but I really think, I want to put a spotlight on your work on the Serving Rural America Act. What are the pieces that need to fall in place? You've been worried about rural hospitals, frontline workers in rural areas, medical care for people in the rural area, which also includes many, many seniors. Just in real short form, what are a couple of the missing pieces that you need to be put in place to help solve that bridge?
Well, I can tell you, yeah, most healthcare providers, small community hospitals here in rural America, they have very, very large Medicaid constituencies, patients. They have large Medicare patients, populations. I can tell you, we cannot when we start trying to manage cost of healthcare, we cannot let the first place we go to be reducing reimbursements to healthcare providers. I mean, in rural America, they are almost at the breaking point. You can't build something for $1 and sell it for 33 cents and expect to stay in business very long. We can't attract healthcare providers to come to the region. So making sure that our healthcare providers can earn a living, and telehealth would be another a big boost to that, because it cuts down on the cost of running an office operation as well, when they can do that. So
yeah. Well, thank you for that, and thank you for your work on both of those fronts. We have a short question from Dr. Sal Giorgiani of the Men's Health Network. Is Sal with us? Hi, we've got Sal there, I think.
I'm there.
Great, and we've got time for a brief question from you, Sal. Go ahead.
Okay, hi. Thanks very much for taking the question. I'm the senior science advisor for the Men's Health Network, which is the 25-year-old not-for-profit organization that advocates for the health of men and boys. One of the things we're concerned about is that while the COVID virus is affecting people worldwide and everybody, men are dying disproportionately. Almost twice as many men die as the women from this virus. We're concerned that there's not an awful lot of attention paid to men within the federal agency to coordinate services. We would like to get an idea if there's any possibility or if there's any work being done to establish an Office of Men's Health within the HHS. We also would add that under ACA that there was an Office of Men's established for the Indian Health Service, but that hasn't, it's been authorized, but it hasn't even been established yet. So what are the chances of establishing an Office of Men's Health similar to the Office of Women's Health that's been around for many, many years and done spectacular work?
Thank you. Thank you for joining us. Thank you. Let me ask the Congressman, interesting point. I did not know the data about the mortality of men to women in this coronavirus, this vicious pandemic. Any thoughts on Sal's question?
Yeah, Sal, thank you so much for bringing that question up. I think this is one of the things that points out one of the facts about the coronavirus. We don't know yet what we don't know. We don't know why it's affecting men worse than women. My wife would be very quick to point out that just proves that we're smarter than you guys are. And I would be the first one to agree with that.
Right.
But I can tell you that we don't know the long-term implications, for example, on those that have recovered from coronavirus. What has
Right.
been the damage to the lungs, and what is their long-term prognosis for potential healthcare implications as a result? So I think a lot of studying is going to have to be done after the fact to find out. But I think Sal brings up a very good point. Trying to figure out why men are more prone to this than women is a very valid question.
Well, thank you. Well, Bill, thank you for joining us. And you look great in Ohio, and look forward to getting out there. But one of these days, I want to get you into the studio here in DC with me. It would be a lot of fun.
Come on, I'm ready to go.
Thanks so much for joining us today.
Thank you.
Now, coming up on the program next are some of the smartest leaders in the healthcare space who are at the forefront of the fight against COVID-19. I'll give you a sneak peek. Dr. Patrice Harris of the American Medical Association, Nancy LeMond, who I just talked about, of AARP, and Congressman Fred Upton, the former chair of the House Energy and Commerce Committee, among a lot of other superstars. But first, it's time to hear from our underwriter, the Better Medicare Alliance.
I'm MARILYN SERAFINI. I'm the Health Project Director at the Bipartisan Policy Center. I'm here with Congresswoman Allison Schwartz, who is the president of the Better Medicare Alliance. So we're facing a difficult situation in our country at this time, and it's particularly a difficult economic situation and a health situation for people over the age of 65, many of whom are living on fixed incomes. Financial concerns, of course, are now exacerbated by COVID-19 pandemic. People are losing jobs, they're being furloughed, and everybody's really watching their pennies. Let's spend a little bit of time talking about Medicare Advantage. We know that more than a third of Medicare beneficiaries choose to get their healthcare coverage through Medicare Advantage. So, Congresswoman, tell us about the work you do and how Medicare Advantage plans are responding to COVID-19.
Okay. Well, I'm pleased to be able to do this interview. But first, let me tell you just very briefly about Better Medicare Alliance. We are a national coalition that advocates for Medicare Advantage. So we are a coalition of actually 143 organizations. They are plans, health plans, and provider groups, health systems, and primary care physician groups, as well as professional associations from the American Nurses Association to the Telemedicine Association, which I'm sure we'll talk about telehealth, but as well as almost 500,000 beneficiary advocates who we work with to advocate for themselves and the healthcare that they value. So been around for about 5 years, and we do both research and policy commentary and advocacy to make sure that there is a strong Medicare Advantage option, which has been growing. Many Medicare beneficiaries get to choose how they get their benefits, either Medicare Advantage or traditional fee-for-service Medicare. And as you point out, it's about 36% of beneficiaries are in Medicare Advantage. They've chosen that, and it's about over 24 million Americans and growing. So the system is one that is an integrated system. It is one that you choose the network of providers who work together to provide comprehensive coverage, all the coverage they're required to cover all the Medicare benefits, but they're also allowed, if they can save money by helping keep people healthy or keep out of the hospital or the ER, they are able to use some of those savings to invest in additional benefits that are not covered under traditional Medicare. And what that really means for beneficiaries, particularly in the time you're talking about, which is right now in the middle of a national health emergency, a pandemic that is affecting every one of our lives. You and me sitting at home, doing our work from home if we're able to, you pointed out that many families are seeing furloughs in their families. Many people, and particularly, this is hard for all of us, but particularly for seniors, and I'm over 65, so I'm one of them, looking out for ourselves by staying home, by being very careful about social distancing. And actually that means also somehow staying a little further away than we'd like to from our loved ones. I have 2 sons, 2 daughter-in-laws, 2 granddaughters, one is 7, and we get to stay 7 feet apart, but I haven't been able to give her a hug or, for a couple of months now, and a 3-month-old who I'd love to hold, but I'm not supposed to. So these are tough times for us as grandparents, as parents, and as also for seniors, they have many chronic conditions. So frequently. So even in the midst of the pandemic, where we're trying to keep ourselves safe from COVID-19 and do the proper things, we need to be in touch with our healthcare providers. And that's where I think Medicare Advantage has really been able to step up in this crisis, as so many of the, for everyone is trying to do that. You see really great, enormous disruption in our healthcare system. So we see New York or New Orleans or Michigan, we are following all of that. Washington State, of course, where we saw first cases. But what we also need to see is how do you actually get care to the people who need care, just need routine care. And Medicare Advantage plans, first of all, stepped up and said they will have no copays. Many people do not pay zero premiums. Half of the people in Medicare Advantage don't pay any premiums, which is great for their Medicare coverage, Medicare Advantage coverage, and for Part D. But also, they now don't have to worry about copays for testing. Most plans, or many of the plans, have also said no copays for treatments. That's a relief, not to worry about those additional expenses. But where Medicare Advantage actually, I think, really was able to step up was to reach out to their patients, provider groups, health groups, many of them that are part of our alliance, talked about even when they had to shut down their offices so their patients could be safe and their staff could be safe, they knew who their patients were. They had care teams who could reach out to them, particularly for those who were at high risk, had chronic conditions, who needed to be in touch with a practitioner. One who said they were calling every one of our patients, going down the list from the most severely challenged with chronic conditions to everyone else. And of course, they moved to telehealth visits, which has been something we've seen across the systems, but we really had already Medicare Advantage plans were allowed to provide telehealth visits, and about 40% of them already were doing it. So they had to scale up, but they had systems in place to do it. So just can touch on a few things that we know we've seen them do.
So let's talk a little bit more about telehealth. You mentioned that even if someone does not have COVID-19, seniors have a lot of medical needs. And if you need to see the doctor, right now is not the time to be walking into an office or to walk into the hospital if you can help it. So talk a little bit more about what the plans and providers have been doing in the way of telehealth. What does that look like, and how have the Medicare Advantage plans stepped this up?
Yeah, happy to. And so when some of these stories about what's been going on in Medicare Advantage, we are putting out today a spotlight on innovation on Medicare Advantage's response to the COVID crisis. So, and when you go on our website at Better Medicare Alliance and find that spotlight, if you are watching today during this virtual event, we're going to make that available. You probably see it on the screen somewhere. So you can check it out. So I think we have about 15 of our providers and plans and community partners who talk about how they've stepped up and some of the really interesting work they're doing. Just to talk about telehealth is, one of the things is to, first of all, have a system as a provider that enables you to do what we're doing, and to do that with patients in a secure way. So of course there are regulations about confidentiality and security, and you don't want more than one patient listening in at one time. You want to be able to do this in a really secure way. Some of them really had systems already, plans already had some contractors who were doing telehealth. And others who were able then to scale it up. So we have one provider who said, must have been like 2 weeks into the stay-at-home rules, saying they were delivering iPads to patients who they really felt like needing to see them, not just talk to them on the phone, was extremely important. And so unfortunately, just last Friday, CMS said that would count as a medical expense, which is fantastic. And CMS, the federal government, did also step up and say that televisits themselves would count as a clinical encounter, which is really great too. So that all helps. But even before all that happened, a lot of Medicare Advantage plans were setting up systems, having appointments basically by telehealth. And it is a great way to make sure that people with underlying conditions, whether it's cardiac conditions or COPD or kidney care that they needed. You know, they have chronic kidney disease or hypertension, or actually it turns out all of the comorbidities that make you more at risk should you get COVID. They were able to reach out, not do everything, but know then when they can actually say, okay, you are someone who needs to be seen. Here's where you go. So I think that was important for the clinical care, but also important to reassure seniors in particular, or those who are disabled on Medicare, that they knew who to call, you know, when there's a problem.
So in the last minute that we have, what should and do you expect Congress may do moving forward? They've already taken a lot of action to send out a lot of money to both patients and to hospitals, and to try to ease the financial situation. But and to ease these telehealth barriers. What else should or do you think Congress may do moving forward?
Well, first of all, we have seen Congress step up and really take some extraordinary action in a bipartisan way, which is important, particularly to attend to the economic crisis that's going on in so many families and businesses across the country. And we've seen CMS step up and waive certain rules. Thank you both Congress and CMS for doing that. But we need, going forward, to continue to see the kind of bipartisan support that Medicare Advantage has been able to garner over the many years. We've seen 75% of members of Congress signed on to a letter in support of Medicare Advantage just this year. That was extraordinary, particularly given the number of new members who are in Congress. So thank you, Congress. I just ask you to look out for Medicare Advantage. It has very different rules than the fee-for-service system, and we look forward to your continued support to make sure that those 24 million beneficiaries and the ones signing up for 2021 will have access to the quality integrated care in Medicare Advantage.
Okay, Congresswoman Allison Schwartz, Better Medicare Alliance, thank you very much.
Thank you, Congressman Schwartz and MARILYN. While America's older residents are our most resilient, having lived through wars, economic downturns, and other health scares at this moment, they need easy access to quality, affordable care. How can Medicare ensure all of its beneficiaries receive timely care, whether for COVID-19 or other chronic conditions? What innovative technologies can best serve this demographic, and how can underserved communities get the attention that they need and deserve? For answers to those questions and more, here's the rockstar panel. I promise you all, I'm so excited about this. Karen Freeman Wilson is president and CEO of the Chicago Urban League. Nancy Lamond, executive vice president and chief advocacy and engagement officer of AARP. Dr. Patrice Harris is president of the American Medical Association. And Susan Peshin is president and CEO of the Alliance for Aging Research. Okay, this is super cool that you're all here. Really, really appreciate your time. Patrice, let me start with you. You represent physicians, frontline healthcare workers. We're talking about seniors today. What do you think are the 2 or 3 most important things that we could fix now to move the ticker up on how we're serving seniors in this time?
Well, first of all, let me say it's a pleasure to be with you here today to make sure that we are doing our best to get the best care for our seniors. And I want everyone to know that the American Medical Association has as its first priority the health of our nation. I think it's very important. We've heard a lot of talk about telehealth, and so I won't make any of those same points. Certainly, we have been very glad to see work from CMS and Congress to relax some of the rules around telehealth. But there are challenges, and we will need to continue to discuss those. We want to make sure, again, those in rural areas have access, which is one of the reasons for we advocated for the telephone. We also want telephone coverage. We also want to make sure regarding pay parity. You heard the congressman say that a lot of physicians have embraced this, but I've experienced this myself, there's not always pay parity with telehealth and in-person visits. And
can you explain to the layperson what that means, pay parity? Is that you're not reimbursed at the same levels for sort of virtual care versus physical care? Donna Shalala was telling me about that, and she said I could mention that. The Donna Shalala, representative from Florida, said that's one of the biggest problems out there that she's seeing and the frustration. So you're making a similar point.
And you know, as we get through this crisis, on the other side of this crisis, there will be a pent-up demand for health needs, and I'm worried. We're worried at the AMA
Right.
about practice viability, particularly in areas that
Right.
are already under-resourced. And so that's why that's important. But we are very glad right now about the rules. And I'll say this, I know we want to have a discussion. I will say that here's what I think we should do, though. On the other side of this, we should not assume that any one action is a panacea. And so when we have the time to catch our breath, we do need to have a thoughtful, I believe, evidence-based conversation about what worked in
Right.
some of these changes
Right.
and what didn't work. I see patients in my practice, and not all of my patients like telehealth. They prefer to see me in person. Of course,
Yeah.
not everything can be solved by telehealth.
I want to get to my other panelists with you and get this all going. We can be like the View on, you know, senior health coverage, et cetera, today. But before I move on, Patrice, one of my friends who actually works for a hospital system out in California said, hey, one of the challenges out there in telehealth is interoperability. And as far as I understand it, in the 30 seconds I had to, you know, message back and forth, that it has to do with devices, that as we get more user-friendly devices, there are actually a lot of things in terms of privacy and HIPAA and all of this that you can end up creating different ecosystems that weren't ever supposed to be connected. How big a deal is that?
That is a huge deal. You know, we're still on our journey towards
So while I'm casually
interoperability.
talking about health by the phone, that's not,
Yes.
not necessarily a good thing.
That's right. And so we will have to make sure we appreciate the context. As a psychiatrist, I'm keenly aware of issues around privacy and confidentiality. So that will have to be a key part of our discussion going forward. And I'll make one last point about telehealth. Again, believe that it should be integrated, right, into medical homes. And what we should not do is allow telehealth to further fragment our care delivery system.
Right. Thank you, Nancy. You know, I took your name in vain earlier, and so I hope you'll forgive me. You know, it's hard of talking about the future of retirement is work. It's one of our, you know, bylines of, you know, my friendship with AARP. But I am interested in your dashboard right now. You're in touch with seniors. Susan Peshin is also. I mean, you all are. But what are you essentially seeing right now? I want to not get into kind of kumbaya stuff. Tell us what's missing. What are people desperate for? What needles are we not moving that you think have to be moved for us to be doing a better moral and a better job on the health front for important members of our community?
Yeah, well, thanks, Steve. Thanks to you and the Hill and Medicare Alliance for convening this. A few quick points I'd make. First, one thing we are totally struck by is how engaged older Americans are right now trying to get information. You would think that was obvious, but we're doing teletown halls at the national level, local level, and we have typically 80,000, 100,000 people on the line. And what they're trying to do is understand the facts. And when they listen to the news, they are listening largely to health professionals. They may be watching a lot of other things, but they're listening to health professionals and are very interested in what the latest is in terms of views on testing.
Not to interrupt you, but I just want to, I do want to interrupt you. Richard Edelman actually made a very interesting point in his coronavirus special edition on trust, and said that health professionals are overwhelmingly the people, the voices that Americans are looking for. They rank sort of 80 to 90% in terms of the trusted voices. Politicians are down about 25 to 30%, if I got the numbers right. Anyway, I just wanted to agree with you vigorously. Go ahead.
No question on health professionals. I always say that next to your grandchild, the most important person in the world to you is your doctor. And that's holding true right now. So there's a lot of interest in really solid information, not surprising given that older Americans know that they are more at risk than many other parts of society. Second thing we're finding, and this relates to something people said earlier, is that 80% of older Americans have a pre-existing condition, and they are not going for treatment for a lot of other things in light of the scare about being in a doctor's office, talking to a doctor with COVID. We think over the long run, this is very serious and something we're going to have to see how to address. Telehealth is part of this. People have talked about it a lot. I won't get into a lot of detail, but also let's remember that part of the reason people aren't as equipped to do telehealth right now is the fact that first, it was not reimbursed by most of the Medicare plans. Second, there's reluctance on the part of patients and some physicians to use it. And fully a third of seniors don't have home broadband or a smartphone. And so we're going to have to kind of work through that. I think in the unvarnished truth area, we'd have to look at the post-acute care system, or non-system as we might want to call it. A lot of attention understandably on hospitals, but think about what's happening in our nation's nursing homes. Majority of deaths have occurred in nursing homes. We have been very active at the national level and at the state level to ensure that nursing homes are, first of all, disclosing the number of cases they have. Second, that the workers in nursing homes, assisted livings, and home health care professionals are able to get the kind of equipment, protective equipment they need in order to not transmit the disease. And then finally is to make sure that there is a way for family members to visit their loved ones. There is nothing more wrenching than to think about people being close to death and not able to communicate at all with their loved ones. And then finally, I just wanted to make the point you and I talked about earlier and several people mentioned, and that is we have been stunned at how many people have raised food insecurity issues during this period. And a huge part of it is people just not having food. We're pushing for more SNAP benefits. And the second part of it is being able to get food. And we're pleased to see so many volunteer activities helping people get food in their homes.
Well, that's quite a punch list, and thank you for being candid. Some of this is in, the sandboxes of our other colleagues on the panel here. Patrice, I know, I've been looking at this issue of elective, not only just elective surgeries, but what you're talking about, doctor's visits, being in touch with physicians, and having that care, which is also, in my view, a kind of mental health thing when you're looking at this beyond a physical health thing. And I know that Patrice's crowd, if I can call them that, are under orders not to entertain some of those visits, right, Patrice?
Well, I think there's a tiered system. There was some misunderstanding of that, and certainly, ultimately, at least from CMS guidelines, they left the decision as appropriate up to the physician to decide. But certainly, yes. So it was some tiered levels of surgery. A non-urgent, perhaps, surgery. But yes, absolutely, a lot of patients and physicians have postponed care. And we really, I know this is another area, and we're not going to talk about it here today, but as we open back up, certainly,
that's my friend Karen is going to get into that.
Well, I'll just put a plug in, we should be prioritizing in that first group, in the first phase, based on data, healthcare establishments, and that is making sure they have the PPE necessary so that they can see patients and begin to do some of those surgeries and procedures.
Good point. Well, I want to talk to Karen and Susan both. Susan, let me bring you in, because another big part of this picture that I think has not been receiving enough attention is the bias and discrimination built in the system. We have been talking about age bias, age discrimination, how we think about health, and to a certain degree, I mean, I want to be candid here, and I want to also be able to get on TV again. There has been a kind of weird sense that the elder community doesn't matter as much in some of the commentary I've seen out there. I've been shocked by that. I'd love to get your thoughts and reactions on, I assume you think that's an unhealthy track, but how do we fix some of this? And I want to bring my friend Karen in to also talk about, as we look at this kind of broad ecosystem, how do we make sure that we're creating a holistic, inclusive approach that's real and not fake when it comes to community health? Susan?
Well, Steve, thank you for having me, and thanks to the Better Medicare Alliance. We're actually a member, so I'm really happy to be a part of today's program. I wanted to first mention, before I answer the question about rationing, just that aging organizations, and I think the Aging Network, we all need to play a role in encouraging older adults, if they do feel like they're experiencing symptoms of heart attack or of stroke, to not hesitate calling 911. There has been so much focus on telehealth, and it's been incredible. But if you fall, if you have an injury, anything serious,
all the other stuff that goes on in people's lives, yeah.
don't
So
hesitate
doesn't
to call
stop.
911. Right. There's a lot of natural fear about going to the hospital right now, but we don't want to deter people from getting emergency care if they need it. In terms of rationing, there's really sort of two issues that I think the COVID-19 pandemic has raised. One are the state rationing plans. We're sort of seeing differences in states across the country with limits and setting sort of definitions about who should get resources if there are shortages. And we heard a lot of horror stories out of Europe, and it started to raise sort of, philosophical conversations as if this were something that were just like a philosophical issue. And there were states that had limitations for people with intellectual or cognitive disabilities, age cutoffs. I mean, some really barbaric, almost eugenics type,
Right.
So the HHS Office of Civil Rights, I have to give kudos to them. They put out a bulletin at the end of March to basically say, look, we have civil rights laws in this country and don't go against them. And some of the states have backed off, pulled off their plans. But there needs to be more specific guidance around. There's still problems, and they're gonna, I think, be putting out more specific guidance in the coming weeks. The other issue that I think it's raised is, rationing goes on in the United States, sort of in the background, and we don't talk about it that much. But there is an organization called the Institute for Clinical and Economic Review, and it's known as ICER for short. And they use discriminatory and old-fashioned economic algorithms. There's one that's called Quality Adjusted Life Years, and it's really kind of an old-fashioned economic model that other areas in economics and from health don't use. And they create these reports that restrict access to new treatments to all types of groups of folks, because it discriminates in particular against people with disabilities and older adults. And I'm hoping that as we're having these conversations, that we have conversations both about the COVID-related ones, but then what is happening on a day-to-day level here, and that we need to move away from quality. We need to move away from judging the patient and things about the patient, and look at—
I'm so grateful. Yeah, I'm so grateful that you brought this up, and I see it right now across not only the healthcare front. I've been made aware of some of the challenges with people with disabilities, but also elders in things like voting. I mean, we are in the political season. We're going to elect the President of the United States and many other elected leaders in November. And, there's a broad question right now, not only, particularly about people with disabilities, but our elder community, I think broadly, about not thinking through that. But that is a different show for a different day. But Karen, Urban League, community health, making these various nodes come together and work well. And you sit in that league of how do you make sure that everybody's engaged to the best we can make them, as we're beginning to thinking about reopening the economy in phased ways. And what we've seen through this crisis is a lot of communities have been screwed. They're bearing the disproportionate share of infection, of mortality, of impacts, both financial across the board. And I want to get your insights into what's happening from your perspective, but any insights you have for all of us on what we can do to remedy this and to be smarter as we begin to move out of this crisis.
Well, Steve, first let me add my thanks for being included in what we know to be an extremely important conversation. And you're absolutely right. We've seen it in Chicago in a very pronounced way, that there has clearly been a disparity both in the incidence of this pandemic, both in the diagnosis as well as the death rate. But we've also seen, as people have tried to access healthcare, as people have tried to deal with the impact of social distancing, disparate impact, both in education, housing, small businesses and in the workforce. But as it relates to our seniors, there is also a concern about the social isolation, the inability to not only connect with relatives, but with your social networks. And we know in the African American community, one of the most important social networks is church. Now we're having Zoom on church on Zoom. Now we're having to depend on calls, phone calls, or other ways to connect with our pastors and those in our church or other social networks. And as we begin to open up, we know that some of these networks will be the last to open up because of the large numbers of people involved. And so I think it's important, particularly for our seniors, that we think about how do we ensure that connectivity? How do we ensure that we are not isolating them even more? And as we look at opening the economy back up, what do we need to do from a policymaker standpoint to minimize those disparities? And that is what we're doing at the Urban League. The Chicago Urban League is announcing a health center that is focused on these issues as we begin to plan for the recovery phase. And one of those key things is allowing for a wellness check for not just our seniors, but for all in our community, so that we can begin to check in on those people who might not have a network of relatives or friends who regularly check on them.
Right. Look, I've got Fred Upton coming up in just a little bit. He's a great guy. We got a good vibe, and it just occurs to me, I want to get and bring a question up. We have a question in the audience to come up. But while we have a minute, and we have a legislator on, and I'm going to make sure that this goes out widely and broadly in the Washington policy community, I want to ask each of you, just for a 30-second slice of what do you need legislators right now in this time to most move? I don't expect you all to be saying, but when it comes to covering seniors, when it comes to, Medicare innovation and what we're seeing out there, just give me one hit at the bat of what you need done. Patrice?
I would say testing. And, we really need to make sure we have a robust national testing strategy. And that is not just the tests, not just the swabs, it's all of that. But we also need to make sure that there's a workforce that can trace, do the contact tracing. And for those who have to be isolated or quarantined, we need support. Many folks live in multi-generational families. If a senior lives in the home, but an essential worker has tested positive, they need somewhere else to go. So we need laser focus on testing.
Got it. Good hit at the bat, or good bat at the hit, whatever it is. Nancy Lamont.
I would say, obviously, agree with testing. And I think looking at all of these changes we've made in the face of a crisis and seeing what needs and should be sustained as we go back to so-called normalcy. And then really what this has taught me is all of us need to spend much more time thinking through the post-acute care world, nursing homes, assisted living, home care, and what all of that really means in our long-term care efforts.
Right. Thank you. That's a good one. Susan.
I think this issue is ripe for talking about out-of-pocket costs for seniors in Medicare Part D. And we need to finally cap those costs for folks. I think it's wonderful that there have been, CMS has relaxed some of the regs around getting 3 months of your medication. But if you can't afford the out-of-pocket costs, that doesn't help you a heck of a lot. So I think a cap on those costs, a smoothing for folks who are unable to afford it all at once. And those are things that were on the table for discussion prior to this pandemic happening. And we have to kind of keep our eye on the ball and revisit.
Thank you. Karen, I'm going to give you the last word before we've got a question from our audience. Just give us the thing you need the Congress to hear.
I think the quantification of this disease. Certainly, we want to do it by race and gender, but I would say that we have to keep statistics by age groups so that we will know the impact that this disease is having on every age, by race, by gender, and by the other statuses that matter to them making policies that will help them to rectify or to prevent us from repeating what we're seeing right now.
Right. Thank you. What a great discussion. We have Marguerite Pridgeon, who's the Director of Federal Policy for the Corporation for Supportive Housing. Marguerite, thanks for joining us, and I understand you have a question that you'd like to pose.
I do. It's kind of a two-part question. The first relates to the nursing homes we had talked about. I want to know specifically what improvements do you think are needed in supportive housing, such as nursing homes, assisted living, to prevent the virus spread we've seen? And the second part relates to, is there an underlying broader issue related to the workforce? What do we need to improve or expand the geriatric workforce in terms of what quantity, quality, and oversight of that workforce to ensure that we have the best solution for our seniors?
Great questions. I'm going to ask my panel to be brief in answers, but let me start with Nancy Lamond. What do we need to do with housing, nursing homes? What do we need to do in workforce?
Well, we need to get people protective equipment and gears and be able to test them if they're taking care of folks. We need to know what's actually going on there in terms of transparency. And in terms of workforce, we're going to have to grow our home care workforce, and we're going to have to support family caregivers much more than we have today.
Got it. Susan?
I think in the nursing home setting in particular, Congress and the nursing home industry has been very reluctant to addressing staff ratios, and that's part of why we've had such a problem there. So I think a willingness to address that head on is really what's needed for infection control moving forward.
Great. Karen?
I would certainly agree with my colleagues. I would also say that widespread testing early on in nursing homes and similar settings is extremely important. I think we've seen a lot of them hide their heads in the sand. They almost don't want to know. The other thing, as it relates to the workforce, we have to ensure that we are not impacting accessibility of seniors to the workforce. We have to put those measures in place that will protect them, but also still allow them to participate widely. We need that wisdom.
Right. I'm going to give the last word to Patrice.
I'd say targeted testing and PPE and in some ways to support caregivers actually who are navigating not seeing relatives and not having information.
Yes.
Marguerite, thank you so much for that question. I want to thank my panel, Patrice Harris, Nancy Lamond, Susan Peschen, Karen Freeman Wilson. Thank you so much. Really hope and stick around. We're going to have a great exchange. I'd like to now welcome Congressman Fred Upton, a former chair of the House Energy and Commerce Committee. Fred and I have talked frequently about the the communities, what's going on right now in Michigan, the coronavirus challenge. And I know you've been working every day out there. Fred, it's good to see you. Hopefully you can hear me okay. Let me just ask you. Go ahead.
I can hear you fine. I've been in Michigan.
Yeah, so I guess in Michigan has been hit hard. Just give us some insight into your senior community. We're talking a bit today about Medicare and some innovations in the Medicare world and universe that have been propped up really in this crazy time, and to what degree that's going to become sustainable. But give us a snapshot of your seniors and what they need today.
Well, a couple of things. And first of all, I enjoyed the presentation, the dialogue that you had with the previous panelists. Very good. And I got to tell you that some of those folks have testified before our committee, and they've always done a really good job. So, Steve, thanks. Michigan, we're one of the harder hit states. I know now, I think we've slipped to 5th or 6th in the nation. We were 3rd. We were an early 3rd. We were an early 2nd. Over almost 3,500 deaths now across the state, more so in Detroit, urban area, folks of color. It's one of the reasons I know one of the last issues was we do need to understand the demographics, what's happened with diversity here in terms of clinical trials. But I would say, is this whole issue has just dominated everything. I mean, can't watch anything except this issue and where we're going and different lowlights and highlights. Seniors are scared. A lot of them are veterans. The first person that passed away in my home county is a guy whose picture's been on my desk for the last couple of years, Vietnam vet, 75 years old, was actually up for the Medal of Honor for all the times that he was wounded. Took him 2 days to succumb. And his wife is, thank goodness, a survivor, a lot of grandkids. I've got elderly parents that live across the street, 90 and 96 years old now. They're scared. They can't, you talk about nursing homes, they can't see their family members. They're just overwhelmed by this disease of which we don't have an answer. And everyone's lifestyle is changed. You go downtown, I did a couple of errands today, post office, etc. I've got a mask on. Our governor, I know she did the right thing when she now has demanded that all employers provide masks for their staff, particularly in retail establishments, and it's incumbent upon us that we protect ourselves as well as protect those folks in retail stores. So social distancing, I think, is working. I'm looking out my porch window. There's not a car has gone by. When people walk by, which hasn't happened yet, they're across the street from each other. So we understand that. We got to get through this, but we also have to work together. You think about Congress, often you got lots of amendments. You watch it better more than anybody else. Lots of controversy always. Right. But now, stage where we don't have time to really debate those issues like before, maybe have a slew of, 50 amendments to a bill, because it's going to take 50 hours to vote on those amendments by the time you clean the chamber and, how do you do committee hearings? I mean, all this is a new thing for all of us. Yeah. And the only way to get to the conclusion is you got to work together. And that's the challenge for us. And certainly in Michigan, our congressional delegation worked pretty well together. Communication with the governor virtually every day as we try to walk through this thing. The one thing what legislators should do, testing. We got to know test, and let's face it, people are going to want to be tested almost every day if they're going to work, if they're in the workplace.
Fred, let me ask you a question. I mean, you're smart. You've been around this long. What's going on the testing front? Why is it so hard? Why are we getting such mixed signals? I mean, I don't want to make the whole show about it, but I just have to ask you because you're such a common sense guy. I'm very, pleased to be talking to you, but what's going on?
Well, we're not there with the technology yet. I think we're on the cusp. I've talked to some folks even today. Testing is going to come along, but no one knew about this a while ago to get ready for it. Right. I think we've done only about 5 million tests, and you got governors competing against each other and everything else.
Well, Mike Pence said yesterday we just sent the tests out. They actually haven't been done. I mean, that was another shocker that between performance and having the tests mailed out. Oh, they're in the mail, but they're not done. Anyway, don't get me going. I'm sorry to divert us here, but
so we need a different answer. The answer that I'd like to think that we can come to is, let's develop a new test. Let's develop a test, an at-home test, so that you and I, before we go to work, we're going to have something, not a fingerprint, but maybe a saliva test or something like that. And they're working on this. That'll instantly diagnose whether you're producing the antibodies to make identify you as an health. And to be able to do that every day, and to maybe take an iPhone when you go to work, and you'll say, "Hey, I'm free. I'm test free. I'm okay." So that your compatriots, your people, at the front door, and people at your fellow desk, or you're on the factory line or the bagel shop, wherever it is, they're going to know that everybody there is safe.
So what you just did in raising your phone up here is in part the conversation today, which is innovation in and around the health space. And some of that's being paid for now and being supported. Some of that is telehealth. Some of it's going to be loaded into, our daily diagnostics of each other. which parts, I mean, and I also know that on the other side of this vaccines, you've been a big driver of the 21st Century Cures Act. And I'm interested in science and innovation that surrounds this question of healthcare in America, and particularly senior care. What do you think are the strongest parts that will stay after the coronavirus is gone?
Well, our life's going to change. So first of all, we need that technology component. We need the teleconferencing. We need all that, and we also need to make sure that our healthcare workers, that they're reimbursed. So CMS, all the community health centers or hospitals, they got to have that component. The other thing, of course, too, and that's where, as you touch on 21st Century Cures, this was literally the last bill that President Obama signed into law, overwhelmingly bipartisan support. Diana DeGette, my partner, she and I led the charge on this. Mitch McConnell and Lamar Alexander and Patty Murray were our partners in the Senate. But at the end of the day, we got to have the therapeutics. We got to have a cure or a way to treat people when they're diagnosed, and that's why I think the market is up so far today, because there's some really good things that are happening that are now becoming public. But we also need vaccine, so we don't have to worry about this, and a lot of work has to be done in that regard. But I just, as Diana DeGette and I had, we put out a concept paper for the next round of 21st Century Cures earlier this week, and we had a good conversation with Steve Hahn today, the FDA commissioner. Enormously helpful. You've seen him everybody's seen him on TV. We're only where we are today for maybe finding the right treatment and ultimately a vaccine because of the work that we did years ago on 21st Century Cures. By allowing these clinical trials to communicate together, to share information, rather than before when they were so siloed, you didn't get the information until the study was complete. Well, all of a sudden, we can now work with folks all around the world and speed that process up by maybe as much as a year or two. So that set the stage for when do we get out of this dark tunnel, and what we need to really push the momentum to find the answers that all of us want to get our life maybe back to normal.
Well, that's a great place to end it. I want to thank Congressman Fred Upton for spending some time with us. Your place looks great. I can't wait till we can get together here in Washington and wrestle through some of this stuff again. Say again?
Degrees. It's like 35 degrees today.
Excellent. Well, thank you so much, Fred. So that brings us to the end of our program today. I want to give a big, big thank you to Congressman Allison Schwartz and the Better Medicare Alliance for their support, and to all of you in the audience. Thank you for those great questions. We hope you will join us in coming weeks as we continue to gather virtually for now to figure out how we can stand united and outwit this vicious virus. In the meantime, I'm Steve CLEMONS. Please stay safe and healthy. Thank you for joining us.